Good afternoon. My name is Maria Altieri. I'm a resident at Stony Brook University Hospital. We would like to thank the program committee for the opportunity to present our data here today. We have no relevant disclosures. So complex hepatopancreatobiliary procedures, or HPB procedures, are considered high morbidity procedures, with morbidity approximately 30 to 40% in some series and mortality of up to 10%. Thus, it is of high importance for us to identify factors to improve outcomes following these procedures. A correlation between procedural volume and outcomes is well established. A paper from 2014 actually is citing that low volume centers have triple the mortality, 30-day mortality, compared to high volume centers. A lot of us consider high volume centers to be academic centers, but that's not always the case. So the purpose of our study was to identify whether if a facility type, academic versus non-academic, has any impact on complications, 30-day and 1-year readmissions and ED visits, and length of stay for patients undergoing hepatopancreatobiliary procedures. For this purpose, following Department of Health and IRB approvals, we used the SPARCS database, which is a longitudinal New York statewide database that captures patient-level data on every admission, ED visit, and ambulatory procedures in the state of New York. Through the use of a unique identifier, we are actually able to accurately capture all readmissions and ED visits because these are being tracked across institutions. So using ICD-9 and CPT codes, we were able to identify complex hepatobiliary procedures, and we used it was between 2012 and 2014. In terms of patient outcomes, we evaluated patient demographics, comorbidities, overall severe complications, 30-day and 1-year readmission in ED visits, and possible risk factors. And the reason why we actually chose 1-year readmissions is because of not unpublished data from this database was that we identified that 30% of patients actually get readmitted within 1 year. Thus, the 30-day might not be the most appropriate, might be lower. So we used the univariate linear mixed models to estimate the marginal association between possible risk factors and length of stay. Facility type, as well as variables, which were significant in the univariate analysis, were further included into multivariable regression models. So between 2012 to 2014, there were over 4,000 complex hepatopancreatobiliary procedures performed, with 1,400 in 2012, 1,350 in 2013, and 1,360 in 2014. And you can see the division between surgeries and year in this graph. So not surprising to us, majority of these patients actually went to academic institutions for their procedures, with 3,500 patients actually going to academic procedures and 569 going to non-academic procedures. Patients differed in terms of age group, gender, race, ethnicity, insurance, and hospital volume. And again, not surprisingly, majority of the high volume centers were actually the academic centers, though close to 6% were actually non-academic. In terms of the differences between comorbidities, so patients who went to non-academic hospitals actually had higher rate of comorbidities. And those were congestive heart failure, neurologic disorders, chronic pulmonary disease, obesity, fluid and electrolyte balance imbalances, and anemia and depression. Patients with higher rate of liver disease and metastatic cancer actually went to academic centers. In terms of complications, non-academic centers on univariate analysis had a higher rate of severe complication, also any complications. And where they fell short was in terms of ventilation, cardiac arrest, infection, and hemorrhage, and those were significant. So following multivariable logistic regression, interestingly, there was no difference between academic versus non-academic hospitals. However, hospital volume was significant, with higher volume having better outcomes. When we looked at 30-day readmissions, facility type actually was significant, with academic institutions actually having higher 30-day readmissions. In addition, any complication, a patient having a complication during their hospital stay had a higher rate of 30-day readmissions. When we looked at one-year readmissions, that did not actually translate. Academic versus non-academic was not significantly different. But again, having a complication during your initial stay actually was a risk factor for one-year readmission. Similarly, 30-day ED visits, facility type did not matter. Any complication did. And one-year ED visits as well, very similar results. When we looked into hospital length of stay, there was no difference in terms of academic versus non-academic, but having any comorbidity or any complication actually will prolong the hospital length of stay. So in conclusion, there is no significant difference in outcomes between academic and non-academic facilities, and it's more volume played actually more role. In patients from academic facilities were associated with higher rate of 30-day readmissions, which we're still trying to identify the reasons for this finding. Thank you.